Hey guys, this is Dr. Bajaj. Today I want to talk to you about our preoperative orthopedic pain management program. So, you've been sent over to me from your orthopedic surgeon, most likely to get you optimized for surgery. Now, we have developed a plan that has been in use for over a decade, utilizing techniques of OR anesthesia and pain management together while emphasizing a non narcotic or minimal use of any sort of dangerous, heavy opioid type medications. We've had a tremendous amount of success with this protocol for years, and I sincerely hope that you see the same results. So, the protocol is as follows. Now, keep in mind, you can always come back to this video to review if needed, or if you have questions, or if you forget anything. In addition, the directions will be specifically discussed on each prescription should you forget which medications to take when. So let's go ahead and begin the conversation. So before your surgery, it is vitally important to get 2 medications on board the night before, which will help you go through surgery with less pain, requiring less anesthesia, and having a significantly better outcome post-operatively. The medication number 1 is called Lyrica. Lyrica is specifically for nerve pain. Now, this medication will be utilized at a dose that we will discuss, typically a low dose, because lower doses of these medications work well with the other medications involved as well. So we'll discuss the dose to take there. You're going to take 1 pill at night for 2 full weeks, starting the day before surgery, okay? Medication number 2 will be a muscle relaxant, and this is intended to help with any sort of spasmodic or spasm type pains that you may have after the surgery, which is very common. The medication you will take for this is called Zanaflex. Zanaflex you will take also the night before surgery, and you will continue for 2 full weeks. Medication number 3 you will begin after surgery. Very important. I'm sure you've all heard of this medication. It's called ibuprofen. Ibuprofen is a tremendously powerful and over-the-counter medication for anti-inflammatory benefits. However, we will give you a prescription for a stronger level of the medication, typically about 600 milligrams 3 times a day with food. Again, with ibuprofen, a few important points. Number 1, you must start after surgery, not before. If you start this medication before surgery, surgery will be canceled because it will thin your blood. Point number 2, you must take ibuprofen every time you take it with food. Otherwise, it can result in gastric issues, which can be another problem set of their own. And finally, medication number 4 will be a very low quantity and very low dose of a rescue type pain medication. Now, your doctor, either myself or one of our associates here at Remedy Pain Solutions, will discuss exactly what medication that will be for you. Again, that medication is intended to be strictly for rescue use only. And I would say about 70% of our patient population do not require use of that medication at all because of the other 3 medications we discussed. Now, there will be other medications involved that your orthopedic surgeon will discuss with you. There may be antibiotics involved. There may be physical therapy and rehabilitation issues. There also may be certain specialty slings that may be either warm or cold or compressive in nature or whatever the case may be. All of those surgical type medications and issues need to be directed towards your orthopedic surgeon or the surgeon doing the procedure. But the medications that we've discussed today, so 4 medications, really 3 and a rescue medication, you will work with our office specifically for those medications, okay? Every bottle will have specifically when to take the medication. And just to recap important points, 2 medications you will take the night before surgery and continue for 2 weeks. You will only receive 2 weeks of this medication, so continue it until the medication is gone. Those medications are Lyrica for nerve pain and Zanaflex for muscle pain. Medication number 3 is an anti-inflammatory. This is to begin only after surgery. Your operation will be canceled if you choose to take this medication before surgery. And then finally, medication number 4 is a rescue type medication. You might receive a low dose and a low quantity, if at all. Very rarely do we actually need this medication. So Lyrica's typical side effects include sedation and sometimes a swelling of the ankles. It's extremely rare to have the swelling. You may also sometimes experience double vision. Also very rare. We take advantage of Lyrica's sedative effects by having you take it only at night. Xanaflex, or the muscle relaxant side effects, typically include sedation. We take advantage of this by having you take this in the evening to augment and improve your sleep the night before surgery, as well as the 2 weeks after surgery. Anti-inflammatory side effects are rare, but they may include an elevation of blood pressure, and they do thin your blood. So be mindful, once again, if you take this before surgery, because of the blood thinning capability, your surgery will be canceled. The medications will be sent in directly to your pharmacy to be picked up after your consultation with myself or one of my team members. Lyrica is the brand name, but Lyrica also has a generic form called pregabalin. So if your prescription bottle says pregabalin, that's the same thing as Lyrica and completely fine to use. Xanaflex is the brand name, but Xanaflex's generic name is tizanidine. So if your prescription bottle says tizanidine or Xanaflex, that's completely safe to use. They're the same thing. Well, I hope this was helpful for you. Should you have further questions, you can email us at info@remedypainsolutions.com.